Hello, my name is Daryl Vansier. The exercises I'd like to share with you are the culmination of more than 40 years of research and practice on my own body and hundreds of clients that I've treated for lower back problems. They are particularly effective for those suffering from spondylolisthesis, compression, degeneration, and herniation of the discs between the vertebrae, and sciatica due to compression of the sciatic nerves emanating from the spine. This gentle and safe sequence will relieve most lower back pain and discomfort, and if practiced on a regular basis, will prevent the recurrence of these symptoms. 3 factors are important to ensure the health and integrity of the spine: flexibility, core activation, and range of motion. This sequence will provide all 3. So here we go. Lie on your back on a firm surface with your knees bent, feet flat on the floor, about hip width, and your heels just ahead of your sit bones. Bring your knees back towards you and place your hands on top of your knees. Allow your arms to relax so that your knees drop away from your chest to a vertical position over your hips. Knees together, feet, arms, shoulders, and neck relaxed, with your head on the floor. Throughout these exercises, pay attention to your breath. Allow your breath to flow naturally in and out through your nose, to feel what's happening inside your body. Slowly begin to shift your knees to the right just a few inches, then to the left, and continue back and forth with this slow rhythm. The slower the better, so that you can pick up on any holding in your hips or at the sacroiliac joints at the base of your spine, and let it go. Don't go too far so that both sides of your pelvis remain on the floor. As you go to one side, the opposite side of your pelvis stays grounded. The knees stay together, and there's a slight scissor-like movement there as you shift from side to side. Notice if one side moves more easily than the other, and fine-tune your movement by letting go of any holding or hesitation. This exercise helps to balance the lower spine by creating space at the sacroiliac joints where your sacrum joins with your spine. Draw your knees back towards you. Then let them drop forward, releasing your hands from the knees, and let your feet come to the floor about 6 to 8 inches ahead of your sit bones, arms by your sides on the floor. Press down on both feet to lift your pelvis up off the floor and swing your hips over to the left and back down to the floor. Bring your knees back, cross your left leg over your right at the knee, keeping both knees bent, and swing your legs over to the right all the way to the floor, or as close as you can. Spread your arms wide with the palms turned up and turn your head to look towards your left hand. Relax your left shoulder so that it's resting on the floor or close to the floor. Let your breath flow and surrender any holding you feel in your body. Now swing your knees back to the center. Uncross your legs, release your feet to the floor. Press down on both feet, lift your pelvis off the floor and swing all the way to the right, then back down to the floor, right of center. Pull your knees towards you and cross your right leg over your left knee and allow your legs to drop to your left. Spread your arms, palms up, and turn your head to look towards your right hand. Let your breath flow and release any holding in your body. It's okay if your right shoulder comes up a little, but try to release your legs to the floor. Swing back to the center, uncross your knees, release your feet to the floor, press down on your feet to lift your pelvis back to the center and back down to the floor. Now for the pelvic tilt. Allow your belly to relax as you breathe in. And when you exhale, pull it in to help push the air out. So it's as if you're inflating your belly when you breathe in and deflating when you breathe out. Extend your exhalation to deepen the contraction in your abdomen, and then just release the contraction to allow the breath to enter without effort on the inhalation. As you extend your exhalation and contract deep into the abdomen, your lower back presses flat to the floor as your pelvis tilts back towards you, and as you breathe in and relax your abdomen, your pelvis rolls forward and your lower back curves back up off the floor. This is the pelvic tilt. Each time you exhale and tilt the pelvis, your spine extends. Feel that extension all the way up your back and neck to the back of your head. Each time you breathe in and release the pelvic tilt, the natural curves in your lower back and neck are restored. This wave or undulation with your breath activates the core muscles that support your spine. This fundamental movement will be used in several of the exercises that follow. Now focus your next in-breath at the top of your belly, at the solar plexus, just below the rib cage, so that your belly and chest expand at the same time. Then exhale with the pelvic tilt, contracting the abdomen. Keep your belly pulled in, release the pelvis forward, and breathe directly into your chest, feeling the rib cage expand in front and back. Then exhale naturally and let everything go, and continue this pattern for several breaths. Breathing in at the solar plexus so that the belly and chest expand together. Exhaling, belly in, pelvic tilt. Release the pelvic tilt, but keep the belly sucked in as you breathe up into the chest. Then let everything go as you exhale without effort. And repeat that same pattern. Your ribs are attached to your spine, so each time you stretch the intercostal muscles between your ribs with this rib cage breath, you create space between the vertebrae of your spine as well. Relax, allowing your breath to come back to normal. Bring the soles of your feet together and allow your knees to wing out to the sides in the butterfly position. The pelvic tilts will take a little more effort in this position because the lower back is now a little higher off the floor. Exhale, deeply pulling your belly in, pelvic tilt, and press your lower back to the floor. Release your pelvis forward as you breathe in, and continue this movement for a few more breaths. Try to keep the insides of your thighs and hips relaxed to prevent your knees from pulling inward when you tilt the pelvis back. Extend your exhalations. And you may notice that as you press your lower back to the floor, the upper body wants to lift up. So next time you exhale, let that happen and reach forward with your arms between your legs into a crunch position. Then release back to the floor as you breathe in. Continue to move this way in rhythm with your breath. Exhale, belly in, pelvic tilt, reach forward, and rolling slowly back as you inhale. Be sure to initiate the movement in both directions with the pelvic tilt. There's a tendency to lift the head first, which strains the neck muscles when you come up. And if you lift the head first when you come back, you lose the connection with the core muscles that support and protect your spine. So start each movement from the pelvis and send that wave gradually up the spine so that your head is the last part to respond. Now, bring your knees back together and bring them back towards your chest. Spread them apart and reach forward with your arms between the knees and take a hold of the outside of each foot for the happy baby position. Pull back so that your shins are perpendicular and the soles of your feet parallel to the floor. And let your head rest on the floor. Relax your shoulders and neck as well. If this is difficult, place a tie over both feet with one end in each hand. Keep your lower back and sacrum on the floor so that your back doesn't round. And let your breath flow as you focus on letting go of any tension in your hips or elsewhere. Relax your neck and jaw. Now release your left foot to the floor so that your left knee is bent, maintaining your hold on the right foot with your hand or tie. Extend your left leg flat on the floor, flexing your foot back and extending through the heel of the left foot. Place your left hand over your thigh and press down to encourage the leg to flatten to the floor. Let your breath flow. Slide your left foot back to a bent leg position and change your grip on the right foot to take a hold of your right big toe if you're not using a tie and extend your leg straight up. Your arms should be straight and your shoulders relaxed on the floor. Again, use a tie if this is not possible. Allow your leg to sink deep into your hip socket as you extend up through the heel. Keep both hips on the floor and your spine long. Neck relaxed, head on the floor. Allow your leg to bend slightly, and then extend it again. Do this a couple more times. This will teach the back of the leg to let go. And back to the straight leg position. Extend your left leg straight if you can, pressing down on your left thigh with your left hand to bring it flat to the floor. Extend through both heels, then only pull your right leg back as far as you can without bending at the knee. On the next exhalation, lift your upper body to bring your head towards your knee. Take a breath or two. And release back to the floor. Slide your left foot back to a bent knee position. Bend your right leg and bring your right ankle over your left leg just above the knee and let the knee drop outwards. Reach through the opening between your legs with your right hand to join your left hand at the front of your knee, or use a tie if necessary. Your shoulders and head should be resting on the floor. Draw the left knee towards you as you release the right knee away from you. You can even push the right knee forward as you pull the left knee back to increase the stretch in your hip. Flex your right foot to stabilize your right knee joint so that the stretch is focused in your hip and not forcing a rotation in your knee. Relax your left foot, neck, shoulders. Observe your breath to release any holding in your body. hold your breath, you hold somewhere in your body. Keep both sides of your pelvis on the floor. Now, keeping your right ankle over the knee, release your left knee and bring your left heel to the floor right up against your sit bone. Arms by your sides, palms down. Press down on your left foot to lift your pelvis off the floor as high as you can and release it back to the floor. Step forward a few inches, lift your pelvis and lower it to the floor. Step another few inches forward, lift your pelvis up and lower again to the floor. Now, coming back, repeat the lift in the same position. Step back to the second position, lift and lower. Then back to the first position, heel against your sit bone, lift and lower. Now step out a few inches to the side, lift your pelvis, twist your hips out, swing back to the center and lower to the floor. Step out as far as you can, lift, swing out, back to the center, and lower. Repeat in the same position. Step in a little closer to your body, to the second position, lift, twist, and lower. Then back to the first position in front of the sit bone, lift straight up, and lower again. Keeping your right ankle over the left knee, extend your left leg flat on the floor, allowing the right knee to drop to the outside and relax, surrendering the weight of your right knee to gravity. Extend your right leg as well and relax your hips, legs, and feet. Your right leg may feel longer and your right hip more open. Slide your feet back towards you, lift your feet off the floor, bring your legs towards you, knees bent, reach forward between your legs to grasp the outsides of your feet or use a tie in the happy baby position. Release your right foot to the floor so that your right knee is bent, maintaining your hold on the left foot. Extend your right leg flat on the floor, flexing your foot back and extending through the heel of the right foot. Press down with your right hand over your thigh. Let your breath flow. Slide your right foot back to return to a bent leg position and change your grip on the left foot to take a hold of your left big toe or your tie and extend your leg straight up. Your arms should be straight and your shoulders relaxed on the floor. Allow your leg to sink deep into your hip socket as you extend through the heel. Allow your leg to bend slightly and then extend it again. And do this a couple more times. And back in the straight leg position, extend your right leg straight if you can, pressing down on your right thigh with your right hand to bring it to the floor. Extend through both heels. On the next exhalation, lift your upper body to bring your head towards your knee. Take a breath or two. Then release back to the floor. Slide your right foot back to a bent knee position Bend your left leg to bring your left ankle over your right leg just above the knee and let the knee drop outwards. Reach through your legs and interlock your fingers around the front of your knee or use a tie. Release your shoulders and head to the floor and draw the right knee towards you as you release the left knee away from you. Flex your left foot and relax your right foot, neck and shoulders. Observe your breath to release any other holding in your body. Both sides of your pelvis on the floor. When you're ready, keeping your left ankle over the knee, release your right knee and bring your right heel to the floor, right up against your sit bone. Arms by your sides. Press down on your right foot to lift your pelvis up as high as you can and release it back to the floor. Step forward a few inches, lift your pelvis and lower it to the floor. Step another few inches forward, lift your pelvis up and lower again to the floor. Repeat the lift in the same position. Step back to the second position, lift and lower, then back to the first position, heel at your sit bone, lift and lower. Now step out a few inches to the side, lift your pelvis, twist your hips out, swing back to the center and to the floor. Step out as far as you can, lift, swing out, back to the center, and lower. And repeat in the same position. Step in a little closer to your body to the second position, lift, twist, and lower. Then back to the first position, heel in front of the sit bone, and lift straight up and lower again. Keeping your left ankle over the right knee, extend your right leg flat on the floor, allowing the left knee to drop to the outside and relax, surrendering the weight of your left knee to gravity. Extend your left leg as well and relax. Slide your feet back towards you so that your knees are bent and your heels meet your fingertips with your arms extended on the floor beside you, palms down. Using your breath to animate the pelvic tilt, breathe in and exhale deeply, tilting the pelvis towards you. Then release forward on the breath in. On the next exhalation and pelvic tilt, take that movement further to lift your pelvis up off the floor and move back into the support of your shoulders and arms into the bridge pose. Press down into your feet and tuck in the tailbone to lift you higher. Focus on opening the heart area as you breathe in and lift it towards your head, keeping your throat soft. Then lower back down to the floor slowly. Take another deep breath. Exhale. Pelvic tilt. Lift off and up. And this time join your hands, interlocking the fingers under your back. Wiggle from side to side to bring the shoulder blades together and straighten your arms for more support. Use your breath to create more space to grow into. The next time you exhale, try to keep the belly pulled in for the breath in, to concentrate the breath into your chest and rib cage as we did earlier. Feel the breath opening the back ribs as well to relieve compression in the spine. Release and gently lower back to the floor. Bring your knees towards you and swing them over to the right. And bring your left hand to the same side to press yourself up to a sitting position. Now lie down on your front for the Sphinx pose. Place your forehead on the floor with your forearms and hands on the floor beside you and your elbows up against your lower ribs. As you exhale, tilt your pelvis to tuck in your tailbone and press the pubic bone into the floor. Inhale, release. Breathe into your lower back. Exhale deeply to empty your belly, tuck in your tailbone, press into the floor, and this time use that support to lift your torso and head up off the floor, looking up through your eyebrows, but keeping your neck long in the back. Raise your arms and hands off the floor as well to feel all the support coming from your core and lower back and not caving in at the spine. Bring your breath into your lower back to create more space and support. Slowly release back onto your front. Start the same way with your next exhalation. This time, keep your elbows, arms, and hands on the floor to provide some support as you arch up. Pull your shoulders down, away from the ears, towards your hips. Just strengthen your support and protect your neck from being compressed. Think of lengthening through your tailbone and the top of your head as you fill your body with your breath. Release slowly and lower yourself back to the floor. Bring your hands together, one on top of the other, to place your forehead on your hands. And bend your right leg 90 degrees and lift your right knee off the floor as high as you can. Then lower it back down. Swing your knee out a few inches to the side. Lift again and release back down to the floor. Swing your knee out as far as you can without moving the left side and lift your knee as high as you can. Lower and repeat in the same position. Come back to the second position, closer to your body. Lift again. Lower. Back to the first position. Lift up and lower back down to extend your leg alongside your left leg. Now, bending your left leg, lift up, lower, bring your knee out a little, lift, and lower, swing your knee out as far as you can, lift, and lower, repeat in the same position, bring your knee back to the second position, lift, and lower, back to the first position, lift up and lower. Then extend your left leg alongside your right, bringing the toes together and allowing the heels to drop outwards. Extend your arms in front of you. Take a deep breath. Exhale, pelvic tilt. Then raise your right leg straight as high as you can as you breathe in. Release back down on the exhalation. Breathe in, exhale, tuck in your tailbone and lift your left leg as you breathe in. Release as you exhale, breathe in, exhale, press into the pubic bone, and this time raise your right leg and left arm at the same time as you breathe in. And release back down as you breathe out. Breathe in, exhale, press into the pelvis and raise your left leg and right arm at the same time as you breathe in. Lower as you exhale. Deep breath. Exhale, tuck in your tailbone and breathe in as you raise both arms and both legs and hold. Breathe in and out, filling your body with your breath. And release your limbs to the floor. Bring your hands back under your shoulders. Push into your hands and come up into a kneeling position on your hands and knees. Place your hands directly under your shoulders and your knees directly under your hips. Spread your fingers wide apart. Rotate your forearms in and your shoulders out, drawing your shoulder blades down towards your hips. As you exhale, suck in your belly, Tuck in your tailbone and round your back until your head drops forward to come into a cat stretch. And as you breathe in, reverse the pelvic tilt, spreading your sit bones apart and gradually arching your spine until your head lifts, keeping your neck long and looking up through your eyebrows in the cow pose. Exhale, tuck in your tailbone, hollow out your belly and curl up into a cat. Then reverse the process as you breathe in to arch the spine. So continue in this way. Be sure to initiate the movement each time from the pelvis and lower back rather than from your head. Moving in rhythm with your breath. The next time you inhale, keep the belly pulled in to force the breath into the rib cage and create space in your back. Continue for 2 more breaths. Sit back on your heels and lower your head to the floor or towards it with your arms stretched out in front. Press into your hands to help push your sit bones back to your heels or as close as you can. Then relax your arms and your shoulders away from your ears and breathe into your back as if you had gills in your lower back. And come back up into a table position. Tuck in your toes and move back into a squatting position on your feet with your hands on the floor in front of you. Drop your head, exhale, straighten up your legs, hips directly over your feet. Lift up through your sit bones as you press down into your feet. Let your upper body hang loose. Cross your arms at the elbows if your hands touch the floor. You can make yes and no motions with your head or bob up and down to release any holding in your neck. Relax your shoulders. Allow your upper body to swing to the right and hold here for a few breaths. Keep both legs straight and the weight even over both feet. Swing over to the left of center. Straight legs, both feet grounded. And return to the center. If your arms are crossed, uncross them. Unlock or bend your knees slightly. And exhaling deeply, tuck in your tailbone and pull in your belly to begin to curl up slowly without lifting your head or arms, stacking one vertebra over the other. Halfway up, breathe in to complete the lift of your torso. And finally the head to an upright position, standing directly over both feet. And there you have it. Practice these exercises daily if you're experiencing any pain or discomfort in your back. And a few times a week for maintenance to prevent any recurrence of discomfort.